Hello guys, good afternoon. This is Professor Henderson and today I am coming to you with another simple video on the core competency of the nurse educator. So thank you again for tuning into this channel. I want to extend my greatest gratitude for those who have been subscribing to my YouTube channel. Thank you so much for your support. It really means a lot to me. If you like these type of videos, continue to like and continue to subscribe to my YouTube channel. So if you like these videos, continue to like, share, and subscribe to the channel. Thank you so much for your time. So today's video is about the core competency of the nurse educator. So I will try to explain the simple core competency of the nurse educator. So let's dive into the video. So the first core competency of a nurse educator is competency 1, facilitating learning. So as a nurse educator, you are responsible for creating an environment in the classroom, the laboratory, and the clinical and workplace settings that facilitate student learning and the achievement of desired cognitive, affective, and psychomotor outcomes. So that's a lot of words there, but let's try to explain these different how do you facilitate learning? So as a nurse educator, you will be using various domains of learning. There are different types of domain of learning. There is the cognitive, the affective, and the psychomotor domain of learning. So nurse educator use these different types of domain of learning to try to engage students in attaining the student learning outcomes. So these cognitive domains are based on various conceptual frameworks. A lot of times we use pedagogy and androgyny theory to connect with students. So the cognitive domain of learning basically is to promote critical thinking. So a lot of the exams are based on the cognitive domain, and is to help students to develop that critical thinking as a nurse. Now, the affective domain. The affective domain is how a person feels about the learning. Sometimes a person might present a certain concept to you as a student or as an employee. It might not make any sense to you because maybe the way it's presented or it's not clear. So you might have you may feel certain way about the teaching that they are presenting to you. So that's the affective domain. Now, the psychomotor domain of learning. As a nurse educator, just telling someone about or trying to verbally explain a concept to an employee or a student, and how do you understand or how do you know that the student actually grasps the concept or really understand the concept? For example, if you're teaching about trach and vent, and you have in-services or orientation with your nurses about trach and vent, how do you know that your employee or your student really comprehend how to properly suction a patient, or how to administer oxygen or a nebulizer, or to change, or even to change a trach. So the student nurse educators, they use a variety of methodology, such as simulation. We can use simulation, we can use role playing, we can use also demonstration and return demonstration. That way you can measure the competency of the nurse and not just going by what someone tells you that, yes, I am a competent nurse in performing trach care and taking care of patients on a ventilator. So as an effective nurse educator, you use a variety of teaching strategy to promote critical thinking and to evaluate the outcome. So that's core competency 1. So now I want to look at the core competency 2. So core competency 2 has to do with facilitating the learner's socialization, development, and socialization. Nurse educators recognize their responsibility for helping students and employees develop as nurses and integrate the values of behaviors expected to promote a collaborative nursing team. So as a nurse educator, your responsibility is to work with employees in as a collaborative team. What do I mean by that? Is not just like you find a deficit of someone and you trying to talk to them about it and you're very arrogant about it, or you're trying to really, you're not presenting it clearly, and you're not facilitating the employee or the learner's socialization, and you're not fostering teamwork. You're being very belligerent about it, and you're not presenting it clearly. So as a nurse educator, you identify deficits with your nurses or your students, and you provide education, and not just like talking to them about it. It's you provide several in-services on the deficit that you have identified, and you work with the nurse or the student on a one-to-one base, and you can do a lot of mentoring and teaching that way, not just theoretically, but also you can provide that that socialization within the academic or the work environment, to promote critical thinking and also critical reflection. So that's core competency 2. Let's look at the core competency 3. So core competency 3 has to do with the use of assessment and evaluation strategies. So as a nurse educator, we are supposed to use various tools to evaluate our teaching. How do your employee or how do your student evaluate your teaching in whatever environment? It may be in a classroom, it might be in a clinical settings, it could be in a laboratory. So presenting information to students you should also provide a tool for the student to evaluate your teaching strategy. How effective is your teaching strategy? Do you connect with the audience? Are you knowledgeable with the content that you are teaching? Are you using evidence-based practice to support your teaching, or you just going trial and error? So as nurses, we use evidence-based practice to support our teaching and to educate the public on various information using evidence-based practice. So let's look at core competency. We did core competency 3. Let's look at this one, core competency 4. So core competency 4 has to do participate in curriculum design and evaluation of program outcomes. So nurse educators are responsible for formulating program outcomes and designing curricula that reflect contemporary healthcare trends and prepare graduates and employees to function effectively in the healthcare environment. So as a nurse educator, you use various teaching strategies to in curriculum development to educate. Knowledge of curriculum development also includes and incorporate educational theory principles and models. So we use various educational approaches reflecting on a contemporary educational theory and practices to support our teaching. We also prepare nurses and employees to work collectively as a team, interdisciplinary team members, so we can have the best outcomes that are possible. So you work cohesively as a team, and using you can also use various conceptual framework for your curriculum development and educational development also. So, core competency 5, function as a change agent and leader. So nurse educator function as a change agent and leader to create a preferred future for nursing education and nursing practice. So what do we mean by change agent? So a change agent is a person that identifies a deficit or identify the changes needed within a certain organization. So you identify those deficits and you promote, you identify the deficit, and you also come up with a plan of care. How will you correct these deficits, and how will you present the information to the organization? It's not just like identifying a problem and talking about it and just throwing the thoughts out there. Is identifying the deficit and be a change agent. Take that leadership skill to correct the deficit, to fix it, and also to do in services with your nurses and educate your nurses about the deficit and present the changes to the organization and work with other members of the healthcare team cohesively to make those changes.